Now we are going to see how to approach a mystery box. You might wonder, what is mystery box? The entire human body, the abdomen is mystery box. Why I am saying? We have plenty of organs inside. As a student, you will have a little confusion about how to start the abdomen, how to start to study the abdomen. Because as I said, plenty of organs inside. My view is you better go layer by layer. For example, this is the skin of the abdomen. Externally, it is divided into 9 quadrants by 2 vertical lines and horizontal lines, and each quadrant has its own name. Now, you don't bother about this. Just remove the skin, what would appear underneath this? We don't have deep fascia, but we have superficial fascia, fascia scarpa and fascia camper. Remove those fascia and you will get the muscular layer. So you just study about what are the muscles present in the abdomen. We have in the center, rectus abdominis. Laterally, 3 muscles are present, external, internal and innermost, that is transverse abdominis. So all these 3 muscles laterally and in the center we have 1 muscle. So you study about all these origin, insertion and nose supply. You should have an idea about these muscles. Why I am telling? In the lower part, the abdomen is extended till this inguinal ligament. So inguinal ligament is formed by the thickened lower aponeurotic part of the external oblique muscle. So in the inguinal ligament, that is the ligament which divides the abdomen from the lower limb. So over the inguinal ligament, we have an important structure that is called the inguinal canal. So the inguinal canal is a highly important topic. It can be asked in the exam as well as in the viva. So you need to know what are the boundaries, contents and clinical aspect of the inguinal canal. So if you focus on this lower part of abdomen, before getting into the abdomen, in the lower part, we have a canal called inguinal canal, which is actually present in the wall of abdomen. So you need to know the boundaries, contents and applied aspect of the inguinal canal. Applied aspect is nothing but it just causes inguinal hernia. If you take that content, the content is in male it is called a spermatic cord. You need to know about the spermatic cord. What are the components of the spermatic cord? Because the important thing is vas deferens. Vas deferens ends in the testis. Part of the male reproductive system is present within that. So you need to concentrate on that. What is the content in male and female, and what is the clinical application of inguinal canal. Next thing, as we have opened the abdomen, immediately after opening the abdomen, you can see all these organs. On the right side liver, on the left side stomach, and stomach extending like a duodenum, then small intestine, other parts, jejunum, ileum. Ileum continues here as ascending transverse, descending colon, then sigmoid colon, rectum, anal canal. This is the entire GIT. Within that, an appendage, that is appendix. It's a small structure, but it is a highly important structure. So how we are going to approach these organs? We have opened it and we have a name, we have a structure called peritoneum. How we are going to understand the peritoneum? So in my view, according to me, I would suggest certain things. You can study about the peritoneum from the beginning, for which you need to understand the relation between the organs. So either you can study the peritoneum in the beginning itself. When you just complete your inguinal canal, you can shift to the peritoneum. Or else, study all organs. At the end, you just study the peritoneum. 2 ways you can approach. So my suggestion is study from the beginning itself. Only thing, before going to the peritoneum, you need to understand the organs. the placement of the organs, the location of the organs. So as I said, first thing, liver here on the right side, but it is extending to the left side also. But just beneath that, you have a stomach. Stomach is extending there as a duodenum, jejunum, ileum. Then we have a the colon. So ascending, transverse, descending, sigmoid, rectum, anal canal. Now, my suggestion is first understand the relations, then go to the peritoneum. Here, you can study in two different views. One is a vertical, so you can do a mid-sagittal section. So that view will explain the vertical disposition of the peritoneum. Another view is a transverse, horizontal view at various levels, mainly at L1, transpyloric plane. That is important. So you need to know how the investment of the peritoneum over the organ at transpyloric plane. And you can study above that at epiploic foramen level, below that any level. So you can have a general opinion, knowledge about the peritoneum. So to understand, one more question is a lesser sac. To understand that, you need to go little up, transverse section at the level of epiploic foramen. You can do, and you can study about the boundaries of the lesser sac, because that is also an important question. So to approach the peritoneum, to study about the peritoneum, better two diagrams we need. One is vertical, another one is horizontal. If you see the vertical, you can see two different colors. One is the brown, another one is the blue color. So I would tell you, one is simple way to understand. You just empty abdomen is there, you remove all the content. Now you can keep kidney first, then the duodenum, pancreas and spleen next, then stomach and then liver. And below you can keep all the small intestine and the large intestine. Now what you have to do is keep one balloon inside. Now push the organs inside the balloon, not piercing it, just pushing it. You can now understand this is the first balloon and you have pushed certain organs inside. Now you just imagine the posterior part of the balloon is invested over these organs, nothing but that is the peritoneum. And the invested part of the balloon is nothing but visceral peritoneum. Now the entire sac is called the greater sac. Now behind the stomach you keep one more small balloon. Now the stomach is present between the small balloon and a big balloon. The small balloon you can consider as a lesser sac, exactly behind the stomach. So like this you can understand, just get oriented to the area and then you can study. So it will be really, you will get oriented to that area and you won't forget. So it can be easily reproducible in the exam. Next thing, after having broad knowledge about this peritoneum, you can get into the organs, how the organs can be studied. I would suggest first take GIT. So in the GIT, lower end of the esophagus is there and the stomach. You have to be thorough in stomach. It's a highly important question. Okay, so you just concentrate on the stomach. Generally, an organ can be studied by, we have a common headlines like first, the location of the organ, where it is located. Next, morphological features. So what are the surfaces, borders and ends if it has. So we can study about morphological feature. Next is relations of the particular organ, because you need to know your neighbors. While doing surgery, you should not disturb the others. So you need to know the relations. The next thing is blood supply, includes arterial supply and venous drainage, then lymphatic drainage, then nerve supply, and then applied anatomy of the particular organ. So it can be applicable to the stomach. So where it is located, what are the morphological features? Stomach bed, have you heard about this term? So you are going to see what are the organs present behind the stomach. It is going to form a bed for the stomach. Next, arterial supply, highly important thing. It can be asked in a short answer. So which artery gives major three arteries like splenic artery, left gastric artery, right gastric artery. All these arteries are going to supply this stomach. Same way, veins, draining into the portal vein. So you need to know the arterial supply and venous drainage of the stomach. Next, another important thing, lymphatic drainage. Because carcinoma of stomach, you need to understand those carcinomatous cells from the stomach, where it goes through the lymphatic system, which nodes will get affected. So lymphatic drainage of the stomach is highly important topic. You can study the nerves of stomach, that vagus nerve, vagotomy. Okay, so those applicable clinically important things you can study about the stomach. Next, another organ. So the same headings you can just, where the location is, what about the morphological feature. But when you consider the liver, it's a solid largest organ. So you need to know the surface, borders, and in the surfaces, especially you have to concentrate on the visceral surface. Because in the diagram question, they would ask visceral surface area of the liver. And in the clinical, little bit about the clinical, you need to know the lobes of the liver. Another thing is vascular segment of the liver. Because in the porta hepatis, three structures are going to enter. I mean, the two structures entering and one structure is coming out of it. The entering structures are artery and the vein. The hepatic artery and the portal vein enters. Bile duct comes out of it. So these structures, how it is present inside the liver, you need to know. So how the liver is divided into segments, because all this can be applied in the clinical side. So you need to have an idea about the vascular segment of the liver, apart from all these relations, borders, surfaces, all these things. Next thing, so here we have studied about the liver, here the stomach. Remove these two organs, you can see the retroperitoneal organ. Mainly this duodenum and the pancreas, both are retroperitoneal, behind the peritoneum. Then what about the spleen? It is intraperitoneal. So all these three things can be studied together. Why? Because if you see here, these three structures are just in front of the major vessels. In the posterior part of the abdomen, in the center, we have two major vessels. On the right side, inferior vena cava, on the left side, aorta. Just go lateral to that, you have kidney. Over the kidney, you have suprarenal gland. And keep these three organs over that. So you can understand the relations of all the organs now. Just imagine, behind this we have right kidney, behind this we have left kidney, over that we have suprarenal gland, and over here we have liver, and this area is occupied by the stomach. I said the stomach bed, nothing but these all organs are forming the stomach bed. So it's easy to understand if you know the location of all these organs, because all are interrelated. So one relation, if you study for one organ, it will be helpful for the other organs also. You can just easily understand the relation between the organs. So one by one, you can just keep the organs and you can study the relation between those organs. So now here, when you consider the duodenum, exactly two structures are opening into it, minor duodenal papillae in that minor duct, and the major duct, nothing but hepatopancreatic duct opens into the major duodenal papillae, the second part of the duodenum. So when you consider the duodenum, concentrate on all the parts, first, second, third and fourth, but second part highly important because those structures are opening into it. And what is the clinical application of those things? If get blocks, what will happen. So that thing you have to concentrate. Blood supply, nerve supply, lymphatic drainage also important. Why? Because during development, till the opening of hepatopancreatic duct, this proximal portion is developed from foregut and the distal portion is developed from midgut. So it's a junction between the foregut and the midgut. So it is highly important topic. Next topic is pancreas. You know very well. So it is a mixed gland, endocrine as well as exocrine. Both we need endocrine also, exocrine also. So it is highly important topic. You need to know the mainly the parts, as I said, location, parts, relations, anti-relation, post-relations, then the applied importance of it. Blood supply, nerve supply, obviously you have to know. Applied importance. What is applied importance? Mainly that if you don't get the insulin, what would happen? Definitely you will get a diabetes. Isn't it? So diabetes mellitus is the main one. So rest all other exocrine problems, so what all happens due to that juice which is not secreted, means due to any infection. So all these you should know. Okay. So this is also important organ. Then spleen, obviously it's a small highly fragile organ. Know that 1, 2, 1, 3, 5, 7, 9, 11, those odd numbers, 1 inch thick, 3 inch breadth and 5 inch length, 7 ounce weight, 9 to 11 ribs, it is related. All these things you can remember, okay. So the spleen is important because splenomegaly. So what is the function of spleen? It's a graveyard of RBC, we used to say. So what is the function, how it is arranged, and what is the morphological structures, morphological things present over that, and what are the relations, all these things you have to study. And as I said, clinical splenomegaly, what are the conditions causing splenomegaly? So all you should know. So after studying all this, you have one thing. I am not told about this person, This is nothing but gallbladder. What is the function of gallbladder? Storage and concentration. From where it receives? From the liver. So the bile is secreted from the liver and it is coming through the hepatic duct and finally it just enters into the cystic duct and gets stored in the gallbladder. So studying about this is nothing but biliary apparatus. We have intrahepatic biliary apparatus, extrahepatic biliary apparatus. It is highly important topic because gallbladder, you know very well, cholecystitis, a condition called cholecystitis, may be due to any infection, or stones, gallstones, cholelithiasis. So cholecystitis can happen due to the cholelithiasis. So what do you call that? Murphy sign. Again, applied. So all these are applied related. We will be getting cases. So you need to concentrate such kind of things. So here you have an intrahepatic biliary apparatus inside the hepatic. Then hepatic right and left hepatic duct fuse together forms a bile duct, and bile duct fuses with the cystic duct to form common bile duct, which in turn fuses with the hepatic duct to form hepatopancreatic duct, which opens into the second part of the duodenum. That is what together everything is important. So you have to concentrate on all this. So please just to study in detail about this. Next is another important organ. This is a retroperitoneal organ behind the peritoneum. So when you consider these kidneys, what are you supposed to learn? As I told, location of this organ, then coverings of the kidney, that is important. Morphological feature obviously, and after that the covering. What is Zerotos fascia? What is Jacrocandus fascia? What is Hodel fascia? So all the fascia of Tolt, all this fascia you should know. Then cut and see the kidney. So what are the structures you can appreciate from the cut portion of the kidney? So what is pelvis, what is calycis, what is pyramid, what is cortex, what is medulla, you need to know all this. So microscopic feature is different, but macroscopically you can make out all these things. So you have to study about that. And hilum of the kidney. In order, you need to know the structures from anterior to posterior or posterior to anterior. Renal, pelvis, ureter. Then regarding the kidney, you need to understand the relations mainly. How we are going to approach the kidney in case of surgeries, from the back or the front? Obviously from the back. What is Morris parallelogram? How you can approach the kidney through posteriorly. What are the relations of the kidney posteriorly? Because you are going to approach, you need to know the structures present in the posterior aspect of the kidney, in the posterior abdominal wall. You should not disturb any arteries or veins or nerves in the posterior abdominal wall when you approach the kidney, isn't it? So you have to do that. And the anterior relation, obviously. Okay, it is the posterior most structure. We have several structures anteriorly. And in case the right side, we have a duodenum on the left side, pancreas crosses it. So you need to understand the relations. Obviously, blood supply, vascular segments, venous drainage, all these things you can learn. Okay. So applied aspect, you know that renal failure. Why the renal failure occurs? It may be due to the renal calculus, renal stones. Obviously, that is the reason, or any glomerular inflammations, infections that can be studied. When you if you study in detail about the histology, you can understand what is glomerular nephritis. To understand other macro diseases, you can just study about the cut section of the kidney. That is enough. Next is the continuation, the ureter, which actually conduct the urine to the urinary bladder. And together you can study. Then ureter also you can just have what is the length of the ureter and the extent of the ureter, constrictions over the ureter, and the relation, mainly anterior relation, how the right ureter differing from the left ureter. So that thing you can study, including the blood supply. Then ureteric stone, here also you can just stricture, little bit about the clinical aspect of it. Then urinary bladder, obviously you have to study the urinary bladder. It is placed in the pelvic region. So the pelvis also included with the abdomen. Pelvis is what? Between the pelvic bone, behind we have sacrum. So on either side we have pelvic bone that forms a small cavity, that is the pelvic cavity. Within the cavity we have important organs, male reproductive organs, female reproductive organs, urinary bladder, rectum, anal canal, all those things are there. So you will have a separate topic under the abdomen, pelvis. So in the pelvic cavity, what are the organs? So the bladder comes there. This is what I said. So in the pelvic region, we have a diaphragm called pelvic diaphragm that is mainly formed by the levator ani muscle. You please study about levator ani. It's an important topic. So levator ani formed by what are the muscles? And just go beneath that. You have two pouches. Superficial perineal pouch, deep perineal pouch. That is present in perineum. You can ask me, sir, what is perineum? Perineum is nothing but it's just a diamond-shaped area. So when you lie down in a lithotomy position, from pubic symphysis to the coccyx, on either side is scale tuberosity. So it's a diamond-shaped area. That includes external genitalia and anus. So you are going to study about the anus and external genitalia under perineum. So not only that, we have perineal membrane, superficial perineal pouch and deep perineal pouch. Pouch means what you should know, boundaries and contents. That's enough. So next, here we have, that's what I explained. What are the organs in the pelvis? This is male pelvis because you have external genitalia, testis is there. You can concentrate on testis. In histological aspect also, testis is very important. And gross anatomy also, you need to know how to identify the side of the testis. What about the position of epididymis, vas deferens, all are male reproductive organ. That ends in here after confusion with the seminal vesicle duct that opens into the prostate. Again, the prostate is important. So it is a part of a male reproductive system. And then urinary bladder, it's a part of a pelvic organ. Then rectum, anal canal also there. In the female cut section, you can see that uterus, vagina, and in front, say urinary bladder, behind again, rectum and anal canal. So these are the structures present in the female pelvis. You can concentrate on this, mainly the female reproductive system, uterus. Now, in the male reproductive system, as I said, the prostate. So, you need to know the location, various lobes of the prostate, the capsule of the prostate, blood supply, and applied anatomy like benign prostatic hypertrophy, BPH, prostatic cancer. So, how it happens? It's a one word we can say that it is a fibromusculoglandular organ, fibrous tissue, muscular tissue, and glandular tissue. So all things are there. And what are the structures opens into it? Because within this prostate only the urethra passes. So in the urethra we have several structures opens. So prostatic urethra, this is called. So you need to know what are the structures opens into it. Next, the female reproductive organ. So together you can study what is ovary, composed of what. When you gut and see what are the structures present in histological aspect also you can study. Then blood supply, supports, and then the fallopian tube important, because the ovum passing through that and even the sperm passing through that, the fertilization taking place in the ampulla. So you need to know the morphology and the structure of the fallopian tube. And then here comes the uterus. You need to know everything, morphological features, axis of the uterus, anteversion, anteflexion, and then even the vagina, everything you should know. In the uterus, you need to know the parts and supports, various supports we have, ligament support, muscular support, and even the organal support, anteriorly urinary bladder, posteriorly rectum. So you need to know the various supports given by the different structures to the uterus, and anteversion, anteflexion. Then why you need to know all this? Because you are going to study in the clinical area, you are going to know what is prolapse of the uterus, what is myoma of the uterus, fibroid, what is endometriosis. So these are the conditions you can understand after studying about the uterus. Okay, first normal, then you can understand the abnormal things. So all these, including those true ligaments and even the false ligament, nothing but the broad ligament. It's a false ligament. It cannot support the uterus, but it is present along the uterus. What are the contents of the broad ligament, extension of the broad ligament? All this you can study. Then important thing is blood supply, all this. Next, another pelvic organ, rectum and anal canal, both in male and female. So where you have to concentrate, what is the location, how it is extended, and what is the interior of each structure, like rectum, how it is placed, what is Houston wall. In case of anal canal, what are these anal columns, what is the anal valve, what is that gland, what is white line of Hilton, what is pectinate line. You need to know everything. You need to know what is white line of Hilton, pectinate line, what is the embryological significance of that pectinate line. So you have to know the interior of rectum as well as anal canal, and their blood supply is highly important, because the portocaval anastomosis is going to take place. So portocaval anastomosis you should know where all it happens. That is also important question. Portal vein and portocaval anastomosis. Here portocaval anastomosis happens, and any portal hypertension leads to what? Obviously it's a hemorrhoids. So varicosity here in the lower part of the anal canal, isn't it? So this is how you have to study. I just told about the last part of the GIT, isn't it? I mean the terminal portion of the GIT. We have in the large intestine, small intestine and large intestine, grossly you can differentiate and you can study. In the large intestine, the proximal portion, that is cecum, and the appendix. So you have to concentrate on appendix and cecum too. Appendix mainly, because we all know that the commonest thing which occurs in the abdomen on the right side. Okay, if anyone comes with the pain, means we can just we could have an idea. Okay, maybe due to the appendicitis. So you have to know what is the normal location of the appendix, what are the different locations of the appendix, blood supply, lymphatic drainage, venous drainage, and other applied aspects of it. So that is also an important topic. Here comes the perineal region. I already told you what is perineal region, but here what you need to concentrate, what is superficial perineal pouch, what is deep perineal pouch. Actually, this is the deep perineal pouch of a female. So here you can see all these contents of the female. So as I told, let's concentrate on boundaries and then contents in case of these two pouches, superficial and the deep pouch, deep perineal pouch. In male as well as in female, you need to differentiate the content and the boundaries of a male superficial deep perineal pouch to female, between the difference between the male and the female. So this is how you have to follow. You can just go according to this to understand the entire mystery abdomen. Okay.